Nigeria. Welcome once again to the channel. I want to say a very big thank you towards many who has been following this channel. I pray that the good Lord will keep blessing each and every one of you. Very big aim into that. All right. Nigeria's health sector requires $500 million annually for research. Okay. Nigeria requires at least $500 million per annum to carry out a concrete research in the health sector, says the project manager for Nigeria COVID-19 Research Coalition. Mr. Ayo, who made this known at the first anniversary of research colloquium in Abuja on Monday, noted that the requirement in terms of funding for research in the country is $5 billion. He noted that there is a preposition by the Nigerian Union for countries in Africa to set aside 1% of their GDP as contribution for research and development for national growth. Currently, our national GDP is trending around $4,050, $450 to $500 billion, and 1% of this is around $5 billion, he said. He said that the health sector alone needs nothing less than $500 million per annum to have concrete research that can be of impact to the economy. For the first time in the country, we are capitalizing on triple for R&D, that is an interface between the government, the private sector, and the academy, and we are focusing on the people, he explained. The NCRC was established by the Nigerian Center for Disease Control and the Federal Ministry of Health in collaboration with the Nigeria Institute of Medical Research and the key stakeholders to generate research evidence to aid the understanding of COVID-19 pandemic and also to support Nigerians' response to the current outbreak. The research coalition has a membership of over 50 institutions and also provides a national platform for coordinating research on COVID-19 in Nigeria. A national COVID-19 research agenda was also developed by the NCRC, which identifies national research priorities in line with the World Health Organization's research roadmap on COVID-19. In line with this, the NCRC said it is necessary to review the country's gains, the losses, and the lessons in COVID-19 research from different thematic areas, including but not limited to diagnostic, transformation, and epidemiology, social and behavioral research, health system research, and infection prevention and control. And epidemiologist Ehimaro Igumbo said that the objective of the colloquium is to showcase high quality research on COVID-19 conducted in Nigeria that was relevant both locally and globally, identify gaps in the research landscape as regards COVID-19 and also other health emergencies, and also chart a course for health research priorities in Nigeria. The event was themed 2 years on, gains, the losses, and the lessons in Nigeria COVID-19 research. The national coordinator of NCRC, Chinwe Ocho, calls for sustainable funding for research on epidemic and pandemic-prone disease in the country. Ms. Ocho said the federal government, the private sectors, and the international partners must increase funding for epidemic and pandemic control. Funding for research remains extremely poor, hence the calls for improvement, she said. She said there is need for more deliberate coordination of research in Nigeria to maximize efficiency and impact of research in the country, which is actually based on the country's identified research needs and priorities. We urge researchers to increase the development and conduct of indigenous research tailored to the country's realities to guide policy making and programming. She said, studies on complex ecological health phenomena such as the COVID-19 pandemic should adopt an integrated multidisciplinary syndemic framework in order to understand its actual burden. We recommend capacity building and transfer by strengthening local capacity for multi-sectoral complex research methodologies through the lens of implementation and translational research. Ms. Ochi noted that it is important for researchers to increase studies that employ the One Health approach in the country. She also advocated an increase in the patronage of local and African journals, while these journals strive to achieve the highest possible industry standard as regards to publishing high quality, peer-reviewed content. We recommend the application of the quadruple helix model that incorporates the government, research institution, the industry, and the health consumers in the co-production and dissemination of research in order to maximize the pace, the significance, and the impact of science evidence for action, she said. In his remark, the Director General of National Institute of Medical Research, Tunde Shalako, said that the organization has actually supported the COVID-19 pandemic in many ways. Mr. Salako, who is also the chairman of NCRC, said it has also helped to support case detection and surveillance. I hope that this huge amount of money that they're actually demanding for will be properly used because, to the best of my knowledge, Nigeria is one of the countries that I know that has this poor health sector. I mean, and every year, I mean, these people demand for money to fund the health section, the health sector. So I'm still wondering, and it still baffles me why the health sector should be this bad, unimproved, and lack so many facilities, especially in the rural areas. I mean, there are no stable, there are no developed, there are no proper medical facilities in the rural areas, and this is, of course, causing sicknesses and some other disadvantages to the people, the citizens who are living in the rural areas in Nigeria. Like in some places in the north, even some places in the east, there are some interior and rural villages undeveloped. They don't have good health sector. The health the public health places, the sectors, they are not doing well. They don't have the required facilities, and they don't even have correct and proper medical doctors or medical attendants. So I really wonder why. Okay, they said it is actually for a research. I hope it will really benefit all Nigerians and it will not be for a selfish reason and people's. It is actually very, very, very pathetic that almost all the sectors, and majorly the most important sectors in Nigeria, are being neglected, and they are sinking so down into the ground, neglected without being mindful of what is happening in these sectors. The agricultural sector, it's being totally neglected. Economic sector, the health sector, the academic sector, these things are very important sectors, and unfortunately they are being neglected in Nigeria. It's quite unfortunate. It is very pathetic, and it's very shameful on the government of Nigeria. It's well, let's keep hoping for a better country. All right then, thank you very much. This is the information we've brought to us today. All right, continue to have a nice day, and we hope that you keep following us.